big risk was moving out on my own. I've had a private practice for 4 years, but I was a part of another private practice. I was the only prescriber in that practice, but we had about 10 other therapists, acupuncturists. So I rented space in that area. Another situation in my life where things play out. We were walking down the street one day, and my partner and I had kind of talked about, my life partner and I had kind of talked about finding a space that would work for both of us. Well, that's kind of impossible when you really think about it. And we saw this handwritten sign on Market Street, for rent. And we happened to walk around back and see like the floor plan. This is like designed for us. So it was a big risk to step out and to take my own space. And I'm learning a lot. I'm learning a whole lot of different little teeny tweaks that have to happen on my side of the space, like noise. How to prevent noise. I didn't think of. People talk on Starbucks patio. I had a noisemaker so you couldn't hear us, but I forgot I don't want to hear them.
Sure.
So slowly growing there. So that was a big risk, and it was important to me to step out and be on my own, to do it for myself, to have this space reflect who I am, to have that comfort level for my patients as they come in and be less clinical than the setting I was in before. That was important to me.
How's the dynamic been different going from having a surrounding of people, support team, to having your own space with your life partner?
Well, we don't even see each other. I mean, because we're so busy on different tasks. So that's not at all really changed. But what is different is the little things. The little things. I'm so used to walking in and doing clinical care. I'm doing clinical care right now. Walk in, put my bag down, throw my patients, pull my charts. That's simple. And now I'm thinking about things like, is the kitchen floor clean on the way to the bathroom? How are we presenting ourselves to the patient? And that's not something that I've actually thought about, and I didn't even expect to have to think about that. So that's a big thing that has changed, is the responsibility for the environment. The environment that my patients are in.
Sure.
I actually have had a couple patients, one patient in particular, like, well, why'd you choose this space? Because it was such a change. And my space is kind of hard to find. You can come in off Market Street and you walk to the photography studio and you're like, what the heck? And, but it's easy to come back. And that's kind of been a fun saying I've been able to say to my patients, because I've brought about 40 patients with me from my other practice. I've opened up more hours and have a lot of inquiries, and have probably added another 20 patients over the last 2 months. We opened officially September 1st, but I was increasing hours at the other place to bring them with me. But I would say to my patients as they get there for the first time, like, it's kind of hard to get here the first time, but it's easy to come back. And that's such an awesome statement, because it's so true for that big decision to start to work on your mental wellness.
Absolutely. That statement also really struck me, because it reminds me of an entrepreneur as well. It might be hard to get there at first, but it's easy to come back to it.
It is.
That gave me goosebumps, just thinking about how that can apply in so many different levels of running a business and being a patient, but also running the practice at the
Being a
same
patient
time.
is life. It's just a moment where you sit there and actually reflect on what you're doing and how you're doing it, and commit to making changes for it. So I don't see time with me, whether I'm doing a 30-minute psychiatric med check or an 50-minute hour of therapy, which includes wellness coaching and all that. I don't really see it all that different in life. I want people to get the ideas on the work they have to do while they're with me, and then go out and do the work. Because that's what changes.